So hello, my name's Tim Kelly. I'm a respiratory therapist with Healthcare DME. And this little presentation is an introduction to sleep apnea and CPAP therapy. So to get started, let's just discuss a little bit of what sleep apnea actually is and how it is treated. So when you have sleep apnea, basically what happens when you fall asleep, the soft tissues in your throat are collapsing, and they, just like you can see here, things tend to fall back into the back of your throat, and they create that obstruction, and that results in the snoring and the gasping and stuff like that. CPAP, continuous positive airway pressure, creates a pressure that holds the throat open to allow you to otherwise breathe normally, okay? CPAP is not a breathing machine. It's not a ventilator or anything like that. It is just designed to help people otherwise breathe on their own. Different people can require different pressures. Most of you coming through here have had just a single sleep study, generally an at-home test, or you may have gone in to the sleep lab for what they call a polysomnogram or a PSG. Then they determine that you have sleep apnea. And then rather than bringing you back into the sleep lab for a titration study, where they would put you on a mask and attach you to a machine and then monitor your sleep and adjust the pressure to find the best pressure for you, what they are looking for, and what they do now is they order a self-adjusting machine. So what these self-adjusting machines do, it's that they start off at a very low pressure and they stay there until you fall asleep. Then they can actually monitor your respiratory patterns and flow rates. And when they sense that you are having sleep apnea, they will increase the pressure. They'll increase the pressure until your throat opens up and you start breathing more normally. And then it'll back down again until you start to close up again. And then I'll go back up, and so I'll spend the night doing this, going up and down. It does get to a spot where it does kind of even out, but where that spot will be generally remains to be determined, and it can vary from individual to individual. I will show you on the machine how you will be able to determine where that pressure is, and that's one of the pieces of information we glean from the machine when we do a download, and we'll talk more about downloads in a bit. So this is the machine that we currently use. It is the Resmed Airsense 10 Auto Set. It has a built-in humidifier. This is a water chamber. You pull that out like so. There's a heater plate that will warm the water. The warmer the water, the more humidity the air passing over it will pick up. This is the water chamber. You're going to need to get some distilled water. You open the chamber like so, pour the water in through here. There's a maximum fill line. You want to change the water every day. And by changing it, I mean change it. Don't just add water. Dump the old water out, generally in the morning, and add your fresh water, generally in the evening. And then wash this at least weekly. Just soap and water in the sink is all it needs. We recommend just a decent dish soap, like Dawn or Palmolive or whatever. It does come apart at the hinge like so. For ease of cleaning, there's this gasket that please don't lose or misplace this or anything, because without it the entire system won't work. So that just snaps together like so and like that, and then you just slide it in there. Again, to remove it, you just grab it. This is just a grip right here. Just grab it and give it a tug and pull it right out. There's your filter. Just keep an eye on this filter. This filter is generally replaced every 2 weeks or so. Most insurances allow us to provide 3 months worth of supplies at a time. So when you walk out of here with a setup, most people have 6 filters. That'll be enough to last 3 months. So just that goes in there. This here is your memory card. Okay. This is important. So now, once you get set up on your CPAP machine, you do have to follow up with the doctor. and he needs to see you, see how you're doing, decides whether or not changes are warranted. So depending on which doctor you have, some doctors you can bring this card directly into them and they can download it themselves. Other doctors you need to bring this card back to us and we'll download it and get a copy of it to them. What it's going to show us, it's going to show us how much you are using the machine. It's going to show us if it is set to a self-adjusting mode, it will show us what pressure you are adjusting to. It will show us how well it's actually treating your sleep apnea, how well your mask is fitting, and other information like that. So like I said, can determine whether or not changes are warranted. This card, incidentally, is a copy of the memory. The memory, your therapy data is stored on the hard drive in here. This is just a copy, so if something happens to this card, the information is still here. But when you, so people, once you get set up, you will need to call your doctor once you've been set up and let them know you have been set up and you need to schedule your follow-up appointment. That generally is done about 2 months out. So like this is mid-February, so you would want it sometime in mid-April. Okay, so, and again, you got to bring that card either into the doctor's office or into us for the download. This is the power supply. Okay, it just has your regular standard electronic cord and your converter. And I'm using one that's already plugged in. It just plugs into the back. There's a spot right here in the back where it plugs into. Just like so. So then we have your tubing. There are 2 types of tubing, and which one you receive will depend on what specifically is ordered, and oftentimes what your insurance covers. So there is a standard tubing, which just hooks into the back of the machine right here. You can hook it up directly to the machine, just like that. Okay, but then that tends to create a stress right here on this end of the hose. So what they added was a little elbow. All right, this elbow comes with it and goes right on there like that. It's just a friction fit. It's not locked in or anything like that. And then the hose can go here. Okay, and that can swivel to whatever side of the machine you happen to be on. And then I also recommend that, or caution people not to throw this piece out. When you get replacement hoses, the replacement hose won't come with this piece. I just consider, this piece is part of the machine. It's not a crucial part. It will work just fine without it, but it's a nice piece to have. So that is for the standard tube. Most people will receive a heated tubing. This coil around here is a heating element, or more precisely a warming element, because it doesn't get hot. It only gets up to about 85 degrees maximum. So when you feel it, you may feel it, it may be just slightly warm to the touch, but it won't even be body temperature. What it is designed to do is to prevent the warm, moist air that's passing through it from cooling down and then resulting in condensation. It has this little electrical connection right there. There's a little spot in the back of the machine that just slides into, just snaps into like that. This can swivel also, all right? And then to remove it, you just simply squeeze these 2 things on the side and you can pull it right apart. So this is your home screen. This is your home screen. You have 2 windows in your home screen. Incidentally, this home screen does have a screensaver. This will go dark after a couple minutes of inactivity, and that's normal. But if it is plugged in, it is powered and ready to be used. You have 2 windows. You have an options menu and a sleep report. We will come back to the sleep report in just a moment. This is your options menu. There's a couple things in here that may be changed on occasion, but generally no. Once it's set, it can stay that way forever. But you highlight it and then you select. So these are some of your options. The first feature is an option called the ramp, or the ramp time. This is currently turned off. What the ramp would be for is that if they had brought you in for a titration study and they decided you need a certain level of pressure. Incidentally, these machines can be adjusted anywhere from a pressure of 5 up to a pressure of 20 centimeters of water pressure. If they were to have done a titration study and decided that you needed a pressure of 10 centimeters of water pressure, what this would do is allow it to start off at its low starting pressure and would build up to that set pressure over whatever period of time you set here. However, most of you will be on an auto set where it's going to start at that low pressure and will adjust itself automatically. So even if you did set this, it's going to start off at that low pressure of 5 and it's going to stay there until you fall asleep, and then it will start to adjust as necessary. So even if you were to set a time limit on this, you're not going to notice any difference in how it works anyway. So this is essentially a useless feature right now, so just leave it off. This is the humidification system. The setting for the heater plate. This is a setting for the tubing. And they are both set to automatic, and that's generally where I recommend leaving them. What this does, it's that this actually senses the air temperature and humidity level of the air coming into the machine, and then will adjust the temperature setting, the setting of the heater plate, and temperature setting of the tubing to achieve and maintain a nice comfortable temperature and humidity level. And that is regardless of ambient conditions change during the night, or from night to night, or season to season. What you receive out through the end of the tube will remain consistent. So this also will have a little bit of pressure relief set. The issue with CPAP therapy, continuous positive airway pressure, is because it is a constant pressure. So when you breathe out, you are breathing out against a pressure. That is generally the hard part of getting used to this. What pressure relief does is that when you breathe out, it allows the pressure to drop just a little bit, just as you're breathing out, to make it just a little easier to breathe out against it. It's not a huge drop, it's just a small drop, but it can be noticeable. The machine also is now set to turn on and off automatically. You put the mask on, you start breathing on it, the machine will sense you wearing it and will turn on automatically. You take the mask off, the machine will sense that loss in back pressure and will shut off automatically. Now, I say that with a certain caveat, just because of the design of certain masks. Some of them don't necessarily allow the machine to sense you with that initial breathing on it. And some of them, when you take it off, they still have a little bit of their own back pressure, so they don't necessarily shut off automatically. The point of what I'm saying is that even if it is set to turn on and off automatically, if it doesn't, it's not a fault of the machine. It is generally a design characteristic of the mask. There are two basic styles of masks out there. There are a nasal mask and a full face mask. Nasal masks either generally cover the nose or cradle the nose, and those are usually lighter, less cumbersome. There's less mask on your face, but they do they do require that you breathe in and out through your nose. So if you're any kind of mouth breather, if you have allergy issues or a deviated septum or anything like that, when you try breathing in and out through your mouth, the air is going to go in through your nose and right out through your mouth, and it's a very uncomfortable, very odd feeling. It'll tend to wake you up. If that's the case, then we would probably try you on a full face mask. A full face mask either covers your nose and your mouth, or again kind of cradles your nose and covers your mouth. It does allow you the option of breathing in and out through either your nose or your mouth. Right now this machine is set to a full face mask, and I'll show you why that matters in just a moment. So this is a feature that we will, especially people who are on a self-adjusting machine who don't know what pressure they're going to need. This will be a test that I will run to just make sure that the mask that we try on you is actually going to seal and be an effective mask at therapeutic pressure. And I generally will come back to this afterwards after we have tried a mask on the customer. So. Warm up allows you to preheat the water in the machine if you want to, about half an hour or so before you go to bed. You can put your water in the machine and get into the options menu, scroll down to where it says run warm up, press this button, that'll turn that heater plate on and pre-warm water for you. The only issue with that is you have to remember to do it about half an hour before you go to bed. You got to go into the bedroom and put water in it and all that. So it's a nice concept, but most people tend to not use it because of that extra step that is required. And then so that's the machine, that's your options menu. Is home, and whatever options are set here will remain that way unless somebody gets into it and changes something. Otherwise, unplugging it or power outages or whatever isn't going to cause it to revert to some default settings. Whatever these are, whatever you last leave them, become the new default settings. So that's your options menu. Then you have your sleep report. You can access it this way, or when you turn the machine off, this is the screen that will come up automatically. It's going to show you how much you used it last night. So, in order to be considered a night of use, technically, you need to use it at least 4 hours. Now, that is usage, not necessarily sleep time. So, if you're lying in bed, tossing and turning, and you can't fall asleep, as long as it is on and running, it counts. This tells you how well this is treating your sleep apnea, because these machines may not completely eliminate your sleep apnea, or your sleep apnea may worsen over time. This is one of the things that they look at on a download. Ideally, we want to see these at 5 events per hour or less. Ideally. This just tells you that the mask is sealing properly and that the humidifier is also functioning properly. Down here, you can continue to scroll down and you can look at a little bit more detailed information, and over a longer period of time, you can actually look at up to a year's worth of data. Generally, the last month is good. It's going to give you your usage statistics. So when I say that these machines will, they self-adjust, but they get to a spot where they kind of even out, that's this number right here. That's another thing that they will look at on the download. When we calibrated the machine, when I said the machine is now calibrated for a full face mask, this is why. Every mask has a leak built into it. It's what allows you to breathe out against it, maintain a constant pressure. It also prevents you from rebreathing your own carbon dioxide. It also means that the system is designed to compensate for leaks up to a point. So what the machine will do is that it calculates it for whatever pressure it is at, for whatever type of mask you are wearing that we have in the options menu. It will calculate that you should be going through a certain amount of air. Anything above and beyond that will be considered a leak. Even so, unless this gets up to about 25 liters a minute or higher, that's acceptable. Okay, again, the system is designed to compensate for leaks. Once it starts getting up that high, though, then it does have a hard time compensating. And so you may actually, if it gets up that high and stays there consistently, you will probably start seeing some frowny faces right here, some red frowny faces on the mask seal. This also is your the amount of sleep apnea you're still experiencing even on treatment. This is how it's termed, your AHI, your apnea hypopnea index. So this number here is the average for all the nights over whatever period of time you're looking at. Whereas this events per hour is the same thing, but this is just the number of events per hour last night. When we do a download, we can look at individual nights, but we tend to look at trends and averages. All right. So again, this is your home button. And that is really all that is involved with the machine. Cleaning, and this is true of whatever mask you have. Cleaning is generally the water chamber the water should be changed daily on this and should be washed weekly. The mask, the component, the part of the mask that goes directly against your face, the cushion, should also be washed daily. And then everything else should be washed weekly. The entire rest of the mask, the tubing, water chamber, everything. You just get go to the kitchen, use some soapy water, like I said, a Dawn dish soap or whatever, and just wash everything. This hose is completely immersible. This end is, I don't necessarily recommend soaking it for long periods of time, but you can certainly wash it. Get some soapy water in there, rinse it out real good, dump the water out, hang this up over the shower curtain, run to dry. So that is basically introduction to the machine. And then when you come in for your appointment, we will go over a few more specific details, like what mask you need and stuff like that. So thank you very much.